Tough numbers. Roughly 1 in every 200 children born here in the U.S. will not survive their very first birthday. In parts of North Texas, the numbers are even higher. So part of their impetus here this week, we are taking the time to bring you stories about the work that's being done to change exactly what I just shared with you. But the hard truth, when you look at this, is that some children cannot be saved. That's a reality, and their families need some help. Tonight, Andrea Lucia sharing with you the incredible work that is being done to help parents who are facing what none of us could even imagine.
Is that you? You sent it?
Mommy loves you, Zoey.
Zoey Ngo began as a sweet surprise.
I took a pregnancy test. I put it in an Amazon box or a package, and I put it on the counter.
I knew something was off because she's never that enthusiastic about an Amazon package from me.
With 2 kids already in the mix, her parents, Yvette and Thomas, felt they knew what to expect. So they shared the news and they celebrated.
We still have confetti up there from our announcement.
But at their 20-week anatomy scan, they discovered problems with Zoey's heart and kidney and had further tests done.
When we got the call from the genetics counselor to hear the results, she said, "Is your husband available?" And I said, "Oh, he's at work right now, but you could tell me." And she said, "I'd like for you to try to get your husband." And so at that moment, I knew there was some bad news coming.
Zoey, they learned, had trisomy 13, a rare genetic condition that affects development of the heart, brain, and other organs. In most cases, it results in a miscarriage. And when babies do survive birth, it is often not for long.
Thomas asked to clarify, "So how long are we talking? How much shorter is their lifespan?" To hear most babies don't make it past 2 weeks.
Yeah, it was very scary.
After pressing for more help, the family met with Dr. Terry Weinman.
I would love to not ever have to meet with another family that's going through this.
Her specialty is helping families navigate the unthinkable, providing palliative care or hospice care to the smallest of patients.
What I do is meet with families who are pregnant with a child who has been diagnosed with a condition that is scary and can help the family understand that this might in fact be a life-limiting diagnosis.
It sounds like such a difficult job.
It is a difficult job.
It is also a job that Weinman says didn't exist 20 years ago, when she first noticed that she and her colleagues had different ways of caring for newborns who were unlikely to survive.
And then I found out that palliative care is an actual specialty. And this is new in the early 2000s, and mainly in the adult world. It was not in the pediatric world at all.
So for 2 years, she spent her evenings after work providing hospice care to adults, looking for ways to adapt the practice for her pediatric patients.
We're so focused on the medicine part of it that we weren't focusing on the human part of it.
She created a list of questions to review with parents.
Are we going to stop feedings? Are we going to continue the IV fluids?
From what interventions they want to take to what memories they want to create.
Do they want pictures? Do they want a rocking chair in the room with them so they can read that favorite book to that child that they've never got the chance to do? They can bring their own outfit and dress their baby in whatever they want. They can give a bath, and we do not limit their time with their child.
Like, I had no hope. So it was really scary and lonely. But when we met Dr. Weinman and her team the first time, she would say things like, "So what are we gonna do when Zoey is here?" Which changed my mindset completely, because at that moment or before that, I never even thought about that.
For the first time, the Ngos say, they began to consider what Zoey's life, short as it might be, could look like.
Made us more comfortable with the situation. I mean, as comfortable as you can be. She just gave us hope.
Zoey was born April 18th, 2024.
We heard her squeals and we heard her cute little cries.
She met her parents, her siblings, and her grandparents.
The chaplain, Emily, came in and she helped baptize Zoey. That was something we wanted to plan ahead and get Zoey baptized. They made little crafts for us and mementos for us to take home, like footprints, really ways to help cherish Zoey's life. They took her heartbeat and recorded it for us. So little things that we wouldn't necessarily think about.
She had a chance to go home, to experience love, and to live for 36 hours.
She passed away in my arms.
Harper's in the back.
Zoey's parents are grieving and also somehow grateful.
You want to show us where Zoey is? Come on, show me where Zoey's at. Zoey's spot
Do y'all
is.
remember? Y'all know where she's at.
The perinatal palliative care Zoey received
There she is.
remains rare.
Hi, Zoey. We miss you. We need to bring Zoey new flowers, huh?
But for families like Zoey's, it provides comfort and a small sense of control when it is needed most.
Being able to plan so much in advance and think about all the different scenarios and how we wanted it, I think looking back on our time with Zoey,
Yeah, we wouldn't have done anything differently.
Yeah, deepest thanks to the Ngo family for sharing their story. Dr. Weinman is an assistant professor at the Burnett School of Medicine at TCU in Fort Worth. The school tells us there are a couple of factors increasing patient loads for Dr. Weinman and other neonatal specialists like her. You've got the Texas abortion law, which has prompted more children with genetic abnormalities to be carried to term and puts more families into situations like this. The other issue has been a loss of labor and delivery units in rural areas. Many of them have closed down in recent years, leaving patients to drive as far as 8 hours to deliver here in Fort Worth or Dallas. And I know we hear about people giving birth at home, even on the side of the road. We have stories like that. But if you have a high-risk pregnancy, a complication that arises, or if you're giving birth to a child with a life-limiting condition like Zoey's, it's not that easy.
Yeah. Boy, I got to tell you, the strength of the family, extraordinary to share. So you mentioned the Texas abortion rule a moment ago, the law, I should say. So what role does that law play statewide or nationally when it comes to the increase in infant death rates we're seeing?
Yeah, some of that data is still being collected, still being analyzed. I can say a report in the Journal of the American Medical Association found about a 13% rise in infant mortality in Texas since early 2022 after that ban took effect. The rest of the U.S., it reported, averaged about a 2% increase in that same period. To be clear, though, the uptick in infant mortality rates did begin before that Texas abortion law took effect. It's something that's happening nationwide, and it's a complex issue.
Andrea, extraordinary strong family, obviously, and an extraordinarily wonderful bit of care that they are receiving that we need to see more of. Thank you so much.